But the system is set up where the medical community and the dental community don't communicate. Unless you happen to have a friend that's a physician, or a physician is friends with a dentist, and then it's all social over the golf course. Medicine does not communicate with dentistry, and dentistry does not communicate with medicine. Unfortunately, that's what it's been since I began my career. So the system is set up where the patient is actually abused by the system. I think you can see how that can occur, and it is fact. What triggered me to do this podcast today was a patient I saw this week, which was similar to patients I have seen 100 times. But I was asked to do a little presentation at one of our Middle Tennessee Rotary clubs. I'm a very active Rotarian. One of my colleagues was a member of a distant club from my own club, and he said, "We would love you to have you there and to just tell the club about TMD." And I said, "Sure, you want me to tell Rotarians about TMD?" He said, "Yes, absolutely." Well, I already knew what would happen. I mean, I did a little, as usual, you know, speakers do about 30 minutes, and I put a little program together for public rather than physicians. I'm most often talking to physicians and dentists. And sure enough, after I finished, I said, open to questions. There were a few good questions, but there was a line that formed because several of the people in the room wanted to talk to me about their symptoms. And one of the people in the room came to me and she said, "My husband has been to everywhere and he has all of the symptoms that you noted: headache, earache, jaw pain, neck pain,